Hi everyone, this is an anatomy and physiology video for healthcare students. In this video, we'll be talking about an organ systems overview. First, let's start with some background information. To understand how organ systems are structured, we need to understand the hierarchy of life. So the hierarchy of life starts with building blocks of all matter, which are atoms. Atoms are the smallest units of all matter. They come together and build molecules or compounds, and in turn, those molecules are arranged into cells. Now that we're at the point of cells, we're looking at the building blocks of life. Cells build tissues. Two or more cell types are found in tissues. You may have heard of epithelial tissues, muscle tissues, connective, and nervous. Tissues build organs. Organs have at least two tissue types in them. You've probably heard of heart, lungs, brain, but there's other organs as well. In fact, your skin is an organ. Bones are organs, and so are muscles. We finally get to the organ systems. So organ systems are made of two or more types of organs. There are about 10 or 11 organ systems in the human body. Depending on who you talk to, you'll get a different answer. But we're going to go over the primary organ systems, looking at their functions and their primary organs. Let's start with the integumentary system. This system is the one you often hear about as being the skin system. So in this system, you are seeing it as a barrier to the outside world. It encloses internal body structures, and it is a site for many of our body's sensory organs. So those sensory receptors are telling us about the world outside our bodies. Everything from temperature, touch, light pressure, for instance. So in the integumentary system, we have the skin, which in fact is our largest organ, glands such as sweat glands and oil glands, nails, hair, and then of course those sensory receptors. Let's talk about the muscular system. Now, this system helps move our body and make facial expressions. It works in coordination with the skeletal system. Muscles pull bones. That's how we move our arms and legs. Muscles also help us to maintain posture and to help us maintain body temperature. You may have noticed if you've ever been too cold, you'll start to shiver. Shivering is actually a response of your muscles to help generate heat. The skeletal system is what helps to give your body an internal framework or scaffolding, so it supports the body. Bones, cartilages, and joints all come together to make the skeletal system. So in conjunction with your muscular system, bones also help to provide movement for your body. You might also think about the role of our skeleton in protecting our vital organs. The brain and spinal cord are protected by the skull and vertebrae. The heart and lungs are protected by the rib cage. Our digestive organs have less protection than others. A little protection is offered by the lower rib cage and the pelvic cavity. The nervous system is composed of your brain and spinal cord, cranial nerves, and spinal nerves. These four major organs work together to detect and process incoming sensory information and then dictate outgoing motor responses. So we may tell the muscles to contract, or we might tell glands to secrete. So this is our fast-acting control system for the human body. The endocrine system is a slower acting control system. This system works with hormones instead of neurotransmitters that we often see with the nervous system. So the hormones released by the endocrine system travel the bloodstream to their target organs. These regulate bodily processes, which may be over a longer term period of time. Here you have a list of our primary endocrine organs. Starting with the brain, we have the hypothalamus, anterior and posterior pituitary, pineal gland. In the neck, wrapped around the trachea, there is the thyroid gland. And in the chest cavity, overlying the heart but beneath the sternum, is the thymus gland. Behind the thyroid are 4 or 6 nodules of tissue known as the parathyroid glands. Behind the stomach is the pancreas. Adrenal glands sit on top of the kidneys, and then ovaries or testes are considered the gonads. Let's talk about the cardiovascular system. So the cardiovascular system delivers oxygen and removes carbon dioxide from the body's cells and tissues. It also distributes nutrients. It also carries away waste products. So through the distribution of blood, which is warmer than body temperature, this is how we help to maintain our own body temperature. So you're looking at two primary things here, heart and blood vessels. Vessels fall into two major categories, arteries or veins, and the very smallest vessels are doing the exchanges. Those are called capillaries. So we often don't think much about this lymphatic system, but it's super important because its job is to help pick up escaped fluids from the cardiovascular system and excess fluids found between our cells and tissues and return them back to the heart. So the lymphatic system is not only picking up these fluids, but defending against pathogens. We don't want cancer cells, bacteria, or viruses to get into this system because all the fluids end up back in the heart. So once in the heart, we can redistribute those fluids out to the entire body. Some of the organs you see listed here are called lymphoid organs. They may play a role in other organ systems. You're looking at the appendix, hanging off the large intestine's cecum. Tonsils are scattered around the pharynx, the mouth and nose region. Thymus plays double duty. It is an endocrine organ and an organ of the lymphatic system. It actually helps to program white blood cells. The spleen is located on the left side of your abdominopelvic cavity. It also removes worn out blood cells from circulation, and it helps to protect us against pathogens. Peyer's or Peyer's patches are found in the wall of our intestines. Lymph nodes are cleaning stations. In the picture here, they look like nodules scattered among the lymphatic vessels. They remove bacteria, viruses, and cancer cells before the lymph returns back to the heart. And here, the lymphatic vessels are called lymphatics. These are one-way vessels that return fluids back to the heart. This is not a circulatory system, but a one-way return system, one-way ticket back to the heart. Respiratory system is composed of your nose, nasal cavity, your throat or pharynx. Larynx is your voice box where your glottis and vocal cords are housed. Trachea is your windpipe. Bronchi and bronchioles are progressively smaller branches off the trachea, which terminate with alveoli, little tiny air sacs where gas exchanges occur. The bronchi, bronchioles, alveoli are housed in the lungs, which are an elastic type of tissue that helps us to do gas exchange and move the air in and out of our lungs. So the task here is to exchange gases, get oxygen into our bloodstream and carbon dioxide out. The digestive system starts with the mouth, ends with the anus. So from the mouth to the pharynx or throat, food travels down the esophagus to the stomach, then on to the small and large intestine. It exits via the rectum and anus, but we also have secondary organs that contribute to the processes of digestion. Those include liver, gallbladder, pancreas, and even salivary glands and teeth. So the whole process here is to take food products, break them down to a small enough molecule so that we can absorb those nutrients into our bloodstream. Waste products are then flushed out via the anus. The urinary system is really just 4 organs: kidneys, ureters, which are tubes connecting the kidneys to the urinary bladder, The urinary bladder is a holding tank, and the urethra is a route to the outside world. The urinary system removes metabolic waste. It controls how much water you have in the bloodstream, and it also is helping us to maintain fluid and electrolyte balance, as well as acid-base balance of the blood. Last, we have the two reproductive systems, both male and female reproductive organs. So in the male, there are testes, an epididymis where sperm are matured. Sperm are transported through a ductus deferens to pick up fluids and sugars from three sets of glands: seminal vesicles, prostate, and bulbourethral. So the whole goal here is to produce sex cells called sperm, and also to produce hormones like testosterone. The external genitalia include the penis, which is going to deliver, the goal here is to deliver those sperm to a female's reproductive tract. And then finally, the female reproductive system is producing female sex hormones such as estrogens and progesterone, producing gametes such as eggs, and of course support an embryo and fetus until birth. After birth, milk is produced by mammary glands to nourish the baby. So here we're looking at ovaries producing both hormones and eggs. Fallopian tube connects the ovary to the uterus, and the vagina is often known as the birthing canal. I hope this helps you with an overview for organ systems. Thank you for watching, and if you like this video, please follow my channel.